It is my honor that we have Andre Picard, a journalist from Canada, as our guest today for Health Fitness Revolution readers. Welcome to our magazine. I guess it's the best way how to do so. And I read your biography, extremely impressive. But one title what I really liked was the Canadian Health Hero. Can you a little bit elaborate on that? It's truly a great honor to be named that.
Yes, it is a great honor, and I think it just has to do with I've been writing about healthcare in Canada for many years, almost 40 years now. So I guess you get to know a lot of people, you get to know a lot of things, and you get to be known. So that was a very nice honor to receive.
Also, Queen honored you as well. Can you a little bit elaborate on that as well?
Yes, in Canada, we have the monarchy, we have the Queen, and to celebrate her jubilee, her 50 years in power, she gave out medals to a number of Canadians. And I was very blessed to be included in that group.
And I'm sure that number was extremely small because I know how rare that actually is as well. And my magazine proclaimed Queen Elizabeth one of the fittest heads of states in the world, considering her age. She is in tremendous health, and she is truly a changer for the world, like a monarch with vitality and desire to keep the world in the right place, I guess.
Yeah, I think she must be very strong. She has that big purse that she carries around all the time, so she has good arm strength.
Definitely. Okay, in your professional opinion, what should we expect different in 2021? With regards to COVID-19?
Well, I think it's sort of a mixed bag. And, I think we have to be careful about making predictions. COVID has surprised us a lot over the last year. So a lot of the predictions don't come true. So I have to be careful. But I think there's going to be a very dark period that we're in now where it's going to kind of be the worst, especially in places like the US. It's very bad. The pandemic is so widespread. So I think there's going to be that very dark period, and then the vaccine is going to give us some hope. So I think more and more people will get vaccinated. We'll have the opportunity to slow the spread, to protect the people who are really at risk, like elders, and so on. So I think there's going to be this dark period, and then a lot of light, but it's going to be a very slow process. A lot of people think that the vaccine is magically going to end this, and it's not. It's going to take a long time. Maybe by mid-year, things will start to look a little better, but this is not going away quickly, unfortunately.
Yeah, that's what I was afraid of as well. People think as soon as we have some vaccines right now, the pandemic will be over, but I agree with you. It will take some time. Do you have any vaccine preference and why?
Well, I think practically in the country you're in, you take the vaccine that's available. So different countries have different contracts with different manufacturers. Here in Canada, we have contracts with Pfizer and Moderna. So those are two vaccines that in trials looked very good, about 95% efficiency. So you can't do much better than that. So those are the ones being used in Canada, and they're very good vaccines. They're very similar in the US, as the US is mostly using Pfizer vaccine, and it has very good ratings. So I think you have to use what's available. So far, I don't think there are bad vaccines. There are questions about some of the vaccines produced by China, but there's a lot of politics involved in that. So I don't know if they're just bad vaccines or if it's a political issue. But I think take what's available is probably the message in the short term.
So I guess Pfizer or the Sputnik would be no.
Yeah, well, the Sputnik, it's another example of we don't know how well it works. They haven't published a lot of data, so we can only guess. And then again, the politics come into it. It's Russian, so they don't like it. But who knows? It may be a very good vaccine. We'll find out over time.
Yeah, but my preference would be always like, Pfizer, BioNTech, and Moderna. That would be my preference.
Yeah, go with the ones where there's good research published
Exactly.
and you can see the details.
We know exactly what we're putting in our body. Besides the obvious, social distancing, wearing a mask, and washing your hands, what are 3 other tips you would give to people?
I think one would be to stay at home as much as possible. That's a big thing. Like when you're out and about, it doesn't matter how much you wear a mask, wash your hands, it still increases the risk. So minimize your contacts with other people is probably the single most important message. The other stuff is all ways of doing that, but really try and limit your contacts. If you don't contact other people, you can't get the virus. That's a golden rule. So that I think is a really important one. A key tip for me is take care of your mental health. You know, this is a virus we're worried about, but it's had all these other impacts on your, people are isolated, they're scared, they're alone. That has a real impact on our mental health. So really take care of that. And then I think other one I would add that should be on all the lists is get out there and exercise. You know, there is a virus out there, but you can go outside much more safely than inside. Keep your distance. Go for a run every morning, go for a walk, get on your bike. This is really vital to your mental health, to your physical health, and to surviving this. You know, the stronger you are, the better you're going to survive if you are exposed to illnesses. So those would be my big other three.
I agree with all three of them, and I know you're a big advocate of mental health. And of course, I'm being a big advocate of physical exercise, and you emphasize that as well. And I believe the three tips that you just gave us are the most safest way to overcome pandemic, COVID-19 pandemic, the largest pandemic since 1918 Spanish influenza. So with that being said, the seasonal flu affects children as much, if not more, than adults. Where with COVID-19 was a very little effect on kids. Why is that? Why our children are being affected with a flu even more than adults, but when it's come to COVID-19, almost non-existent, almost non-existent.
Yeah, so I'm not a scientist and there's some complex science involved here, but as a journalist, what I do is try and translate scientific information for the public. So I think the short version of this, there are many, many theories, but I think the one that's most commonly held by scientists today is one that the public may find confusing, but it's because children have healthier blood vessels. So why that seems odd, right? So we think of this as a respiratory virus, and it is. It gets into your lungs, but it's not a virus that damages your lungs. It's a virus that damages your heart. So what's really what the people who have the worst effects are people with unhealthy blood vessels, with unhealthy hearts, because this virus attacks the heart. Children are young, they have really healthy blood vessels, their blood pumps, their heart moves a lot faster than an adult. So that's the protective effect. Now, that being said, we know that there's new variants coming, and those new variants seem to affect children more. And we think it's because of this is a virus with a protein, a spike protein. There's these different spikes that do different things. And the way it's shifting is it's getting easier to cling on to people and attach, and including children. So we really worry about the variants having a bigger impact on children.
So do you think the future variations of COVID-19 may affect children more than adults?
I think
as much?
The early evidence shows that the variant, especially the B117 variant, which is the one that originated in Britain, that one seems to be spread much more readily in children. So it's easier for them to catch it. The good news is there's no evidence that these variants are more deadly. So they just make it easier for the virus to spread, which is bad news, but it doesn't necessarily mean more people will get sick or more people will die. So that's a silver lining, if you will.
You know what? Now I'm asking you a question that we didn't schedule, and that is, how is it possible that in the Western world, with all our medical advances, with technology that we have, we're having thousands and thousands of dead people and hundreds of thousands of sick, and yet China, where the virus started, they're reporting some ridiculous numbers, so low that it's almost impossible to believe for a country with almost 1.4 billion people. What do you think? How are they managing that, or is that even a truth?
I think there's a couple of things. I think one, we have to remember that infectious diseases are very humbling. You know, we have all this medical science, but we still, millions of people a year die of infectious diseases of all sorts, including in China. So, what's going on in China? I think China, what they did right is they acted very quickly. So, if you don't have that virus really in the community, in there, you know, inbred, it's not spreading, that's the greatest protection, right? So that's what everyone should aim for: is get down to zero, and then you can keep it out when you have zero. So they did this. They did this very effectively in Wuhan, as you know, even though it's a city of 11 million people. It's amazing what they did. But you have to also remember it's not a democratic country. What they did would never be acceptable in the Western world. They literally, in some cases, nailed people into their homes so they wouldn't leave. They had armed guards on every corner. We don't have the ability to do that, and we don't have the, I don't think we have the stomach for that. So there are many stories today being published because exactly 1 year ago that Wuhan was locked down. So a lot of stories are looking at China, and China to this day, you know, we like to see the images of them floating on their inner tubes and at the beach, etc. Things are better, but they still have very, very severe restrictions. If you have so much as a sniffle, your house is locked down, you're going to go nowhere, your family's going to be. This is very, very severe stuff. So in a country like Canada, the US, where we have civil liberties, I think this is unthinkable. So that's the downside of being free, is we have more illness, but it's a trade-off in society.
That makes sense. But still, the reporting numbers like a 20, 30 infected per day. In my mind, hard to believe it. But I
It,
guess
and there's that, I didn't mention that aspect, but it is hard to believe. We don't know if the data is accurate. You know, early in the pandemic, there were reports of mass graves in Wuhan. They reported 3,000 deaths, but some people think there were 30, 50,000. So we just don't know.
oh,
Where you control information, that that makes a big difference as well.
that makes sense. In a couple of short sentences, how does a virus mutate? And how should we be concerned with different variation? You just mentioned that the children may be more affected, but how does actually virus mutate? I know you're a journalist, you're not a scientist, but you're such a accomplished journalist and such an avid health ambassador, promoter, searcher, and for knowledge. That's what I'm asking you.
Yeah, so again, as a journalist, I'll oversimplify it, so it won't be scientifically exact. But I think for what the public needs to understand, viruses are like us. They want to survive. So what do they do to survive? Well, they want to spread more easily. So when it spreads, the ones that spread more easily survive, and those that don't die off. So that's how it mutates. It makes little changes. I mentioned before that it has these proteins, these spikes. So the different spikes get more popular, if you will, among the virus, and they spread. So a variation like the one we're seeing now, that's what it's doing. It's allowing the virus to spread more easily. But a virus doesn't want to, for example, be like Ebola. Ebola is a virus that kills really quickly, so it can't survive very long. So Ebola has been mutating so that it becomes less deadly because it wants to survive. The coronavirus is doing the same. And all of them, the flu changes every year. Why? Because it wants to go out there and it doesn't want to make people sick. It wants to live. It wants to multiply. So it's an interesting fascination. And the question that's coming up now is, why are these variants coming up now, you know, after a year? And the reason is, the more people you have, the more mutations are possible. It's just sort of math. It's a chance. A lot of these variations happen by chance. People don't always realize is there's been many, many variations in the last year. Most of them made no difference. We have variants in our body 1,000 times a day. Very few of them matter, but sometimes they matter a lot. And then we get these deadly infections because sometimes you only take a partial, with bacteria, for example, if you take your medication and you only take part of it, that really allows mutations to happen because it doesn't quite kill, it just challenges the virus to change. So there's all these different reasons that viruses and bacteria mutate, but it's again sort of a normal process that we have to adapt to. Sorry for the long answer.
No, it's perfectly fine. And I actually have another question based on the flu season. We have none. How do you explain that?
Well, I think a very simple explanation is the measures we've taken against COVID work against the flu, right? So, wearing our masks, washing our hands, keeping our distance, those are all things that spread the flu every year. And now we're doing them so there's no flu. So, why does coronavirus still spread? Because it's a little more or a lot more powerful than the flu, more deadly. So, we see the impact. But I think there's some lessons here. I think in the future, maybe we'll be wearing masks for our flu season. I could see that winters in Canada that masks just become normal because
Mhm.
we do have thousands of flu deaths every year. It's not insignificant.
Of course. Do you think masks are here to stay?
Well, I think, like I said, I think in some circumstances, yes. I think maybe winter masking is going to be sort of fashionable in countries with winter. I think in some circumstances, we're going to go into large venues for the next 2, 3 years before you go to a football stadium, a hockey arena. I think people are going to be wearing masks in these situations. I think a lot of industries, meat packing, anywhere where people work closely together, auto plants, I think, yes, I think these are going to be the norm. I think in some ways it's going to be a cultural change. They're going to become fashionable. People are going to want to wear their masks in certain situations So I think these interesting cultural changes are going to happen about masks as well.
Now, a funny question or interesting question for many readers. What is the most insane conspiracy theory you have ever heard? We know everybody's talking about some crazy conspiracy theories, especially here in America, but the rest of the world as well. And some of them are literally, I mean, like a equivalent to flat Earth society. So, what is the craziest one you had a chance to hear?
Yeah, boy, I hesitate to repeat any. I don't like to give them any credence, but you hear the one. I think the most frequent one, or maybe the most disturbing one about coronavirus is it was made in a lab in China. And I think that the reason that's concerning is because I think it just downplays the reality that in nature, there's a lot of things, and our interactions with nature matter a lot. So we really shouldn't downplay that. There's no reason that China would want to release this virus. It suffered from it greatly in the beginning. So a lot of these things, there's a lot of Bill Gates conspiracy theories, which I don't think have any credence either, that he's doing this to sell vaccines. A lot of this is very, very far fetched. So I think a lot of them just don't bear repeating.
And now, when we're talking about Bill Gates, billionaires and philanthropist Bill Gates has been donating millions, hundreds of millions of dollars to his foundation to fight COVID-19 and the other infectious diseases throughout the world. Do you think more private donors should follow in his footsteps?
I think philanthropy is important in the world. I think Mr. Gates has done tremendous things in global health. But the solution to this isn't charity. The solution to this is solidarity. It's governments putting all their efforts into this, business, not for profits. We all have to join together and fight a global pandemic. So I don't think any one sector of society needs to do more than the others. I think we all have to work together and not work at cross purposes is important too. So I think this has to be led by governments who are representatives of people to help people survive this pandemic.
No, I agree. This is a world pandemic. Therefore, the world governments need to get together and put the money from United States to Europe to China, all the way around the world. We have to fight this together. Uh, the Spanish influenza pandemic was in 1918, approximately 100 years ago, before COVID-19. Do you think the frequency of global pandemics will increase?
I think there's no question that we're going to see more pandemics and we're going to see them sooner just because of the way the world is changing. Climate change is going to have an impact. We live closer together now. There's more urbanization. We have more interactions with that wildlife and with livestock. So that's where all these viruses emerge. They emerge from interactions with animals. So the flu comes out of pigs every year. The coronavirus came out of bats. Ebola came out of monkeys. So it's all these interactions. And as the world gets more crowded, as we get smaller, as our climate changes, there's no question we'll have worse pandemics. And we just don't know what's coming next. The sad thing to say in the grand scheme of things is that coronavirus is not that bad, right? It's funny to say that, but it's not that deadly. It's not disfiguring. It's not spread that easily, compared to say something spread like the measles. The measles, you can just be in the same room as a person and everyone will get the measles if they don't have a vaccine. Imagine a measles that killed people. We'd have millions of deaths a day. We can imagine these things, and they're a possibility.
You know, your last name Picard actually is one of my favorite heroes, Jean-Luc Picard, Captain Picard. And as a Star Trekkie, as an avid Star Trekkie, I watched every episode multiple times. I can almost like tell you certain scenes. Do you think in a Picard time, 25th century, we will eradicate all pandemics?
I don't think so, and I think as you are a Trek fan, you realize that they meet these challenges all the time, right? They see all the things that Trek is about, reflecting today's failures and projecting them in the future and looking for solutions. And they come across infectious diseases, they come across racism, they come across medical failures. So I think there's lots of lessons in Star Trek. And I don't think these things are going away. We have to figure out not how to live with them, but how to live better to prevent things like pandemics from harming us. They're not totally preventable, but we can really mitigate the damages.
You already mentioned that your suggestions about how to better cope with COVID-19 through exercise in order to be more mentally stable or have less stress. What exercises do you do in order to cope better with pandemic?
Well, I'm a runner, so I like to go out in the morning, early in the morning, and have a run. Currently, I'm living in Vancouver, one of the most beautiful cities in the world. I live right beside the ocean, so I go around the seawall in the morning, and it's very spectacular, very good. I'm not a fast runner; I'm a plodder, but very good for my mental health and a good way to start the day. So that's my favorite one.
Very good. And actually, one of the best to detox your body, feel better mentally, clears your mind. That's what I do as well when I run. And actually, when I run, I do some extreme stuff. I would not recommend people to follow in my footsteps and things that I do. But my challenges are only to motivate people, period, around the world to be healthy and fit. Now, obesity. A lot of people with obesities, when they contract COVID-19, have lots of problems. We're now realizing that healthy lifestyle and building your immune system through physical exercise, healthy nutrition is tremendously important. What is your stance on that?
Yes, there's no question the data show that people with obesity do suffer worse if they're infected with COVID-19. I think, again, it comes down to the blood vessel issue. If you're overweight, your heart is stressed, your circulatory system is stressed, and you're just more at risk from COVID. So I think that's maybe another inspiration to try and get that under control. But I think we have to realize too that obesity is something, because I write about public health, I write about a lot, it's very much an environmental issue. It's not just about self-control, it's about all the pressures in society. Fast food is everywhere. We, especially during the pandemic, spend all our times in front of computers on Zoom. We don't move as much. So there's all kinds of societal and cultural factors to obesity as well. So I'm careful to try and not blame people and try and help them create better environments where they can be healthier and feel better about themselves.
Apropos global warming, Paris Agreement, America is back on track again. We have a new president who believes in science, who believes in facts, who believes in betterment of humanity, period. Are you, as Canadian, happy that Americans have a new president, President Joe Biden?
Well, it probably matters to Canadians more than anyone else in the world. We're right next door. We always call the U.S. the elephant next door. If the U.S. sneezes, Canada gets a very bad cold. So we watch our American politics very, very closely. I would say, I think it's fair to say that Joe Biden's politics are probably much more aligned with Canadian politics. We consider someone like him who's left wing in the US to be fairly right wing in Canada. So it's a little different, but I think there's a much greater alignment there between the way the two countries think now.
No, interesting how the Americans easily give people an attribute of being a socialist when they don't even understand really what socialism means. As a European who grew up in Europe until age of 23, you learned all of that in school. And socialism that they are even giving to Bernie Sanders has nothing to do with the socialism in reality. But people are scared, even by slight changes. But I agree, personally, I love Canada. I put Prime Minister of Canada as one of the fittest heads of states, and he's truly Trudeau. Prime Minister Trudeau is in excellent shape. He exercises all the time. I would love to have an interview with him as well in terms of physical exercises, so he can motivate not only Canadians but also the rest of the world. Mr. Picard, I really enjoyed this interview. You're a wealth of knowledge, and as a journalist, you can bring information closer to the readers. That's why when my team told me that one of the interviews I will have will be with a famous journalist from Canada, I knew that this interview will be easy to understand for our readers, because you take complicated message and simplify it so that majority of people can understand it. Even though in the last couple of weeks I had interviews with top COVID health experts in America, they try to simplify things, but don't forget, they're still scientists. They still don't have that vocabulary that you have. Thank you very much. Looking forward for our next interview if you enjoyed this one. And I wish you all the best. I wish all the best to Canada. And I don't know if it's appropriate to say long live the Queen.
Well, and I'll just say thank you for having me, to asking some challenging questions, making me think. And, I hope, like everyone, that this pandemic will come to an end soon. And to quote Captain Picard, who we both know, let's make it so.